Good morning, everybody. We are back to the press room with Commissioner Janez Lenarčič, who is, of course, in charge of crisis management. Now, the Commissioner will make a short statement about the boosting of the strategic medical stockpile under RescEU, following which we will also take a few questions. Commissioner, please take the floor.
Thank you. Good morning. As you are aware, the COVID pandemic has exposed some serious vulnerabilities in how the international community responds to global emergency, like a pandemic. And one of the most striking issues at the start of this health crisis related to the limited availability of personal protective equipment and also other vital medical supplies worldwide. This situation, this concern, was shared by many countries, including our member states. If you recall the state of play at the end of February, most member states had limited stockpiles and struggled to provide the necessary supplies for their own needs as well as for others who asked for assistance. In response to that situation, the Commission quickly undertook a series of steps to ensure that no member states would ever fall behind in the same manner again. We took action primarily on two tracks that continue. First, in March, we established a new RescEU life-saving medical equipment reserve. Through this reserve, by now, more than 500,000 units of FFP2 and FFP3 protective face masks have already been delivered to Italy, Spain, Croatia, Lithuania, as well as North Macedonia, Montenegro and Serbia. These are professional masks intended for first responders like medical staff, civil protection teams, police and the like. With winter approaching and coronavirus cases increasing throughout Europe, it is crucial that we continue to build up our stocks. In this view, I am happy to inform that Denmark, Greece, Hungary and Sweden have joined Germany and Romania as host states of the RescEU medical stocks. With 100% financial support from the European Commission, 6 EU member states are now in the process of building a common European stockpile of life-saving equipment and other vital medical supplies. These reserves are to be distributed throughout the European Union at times of medical emergencies when national health systems would be simply overwhelmed. The second track started in June when the European Commission put forward a targeted proposal to strengthen the European Union's crisis management system, including the European Union's civil protection mechanism. The objective of this proposal is to provide the European Commission with more tools to support European Union member states as they seek to prepare and respond to complex disasters. This proposal will also help strengthen the European Response Coordination Centre. This proposal aims at the following. First, better preparedness by creating a RescEU strategic reserve at EU level, plus the possibility for the Commission to directly procure capacities. Second, faster response. As to once a disaster strikes, we should be ready to respond immediately by disposing a logistical capacity to ensure timely transport and delivery of assistance. And third, improved risk management and planning for high-impact emergencies through the development of EU resilience goals. I would like to clarify here that it is important to note that these strategic capacities will be supplementary to those of the EU member states. The fact remains that civil protection is the national capacity of member states, and the European Union is to play a supportive role. We would like to preposition strategically this capacity in such a way as to ensure the most effective geographic coverage in response to an emergency. To conclude, with the increased number of host states, RescEU is stepping up our preparedness. With these new measures as well, we will be much stronger in fighting this current pandemic, as well as better prepared for possible other crises in future. In view of the July European Council agreement that has topped up the total budget for the civil protection to 3 billion, I also count on the Council's and Parliament's continued support in this endeavour. With that, I'm happy to take a few questions.
This is the time for us to take a few questions. I see many hands up, which shows the important interest in this topic. I will start with Maria Psara